Okay, so axillary nerve contains two components. One, motor. So we talked about motor. That motor fibers innervates deltoid and teres minor. How about sensory fibers? Right. Say it. The inferior part of the shoulder. Okay. So the superior, not the superior, but the inferior part of the shoulder, inferior lateral, medial, inferior part of the shoulder is innervated by the axillary nerve. Remember? So, and then this area would lose the skin sensation, right? If the axillary nerve is damaged, and we call that a specific name for that. Sergeant patch. So sergeant patch. That area would lose the skin sensation. Okay, cutaneous sensation will be lost if the axillary nerve is damaged. So that's the skin innervation, the cutaneous innervation of the axillary nerve. Okay, so we have two components, motor and sensory. Above that, I didn't mention about the supraclavicular nerve. So at the upper part of the shoulder, supraclavicular nerve, lower part of the deltoid, is innervated by the sensory fibers of the axillary nerve. And in the loss of the damage of the axillary nerve is, you would see a sergeant patch. You would see a loss of sensation of the skin in the lower part of the deltoid, or the upper part of the arm. Okay. So that's deltoid. So what else do we have? Supraspinatus, infraspinatus, and then we have the teres minor major and subscapularis muscle. Okay, so let's look at supraspinatus now. Supraspinatus origin is what? Supraspinous fossa. All right, and that's the origin. Insertion is. So this is the lesser tubercle. This is the greater tubercle, and you have the intertubercular groove or sulcus in between. So from here it attaches to the greater tubercle, right? Okay, so that's supraspinatus. Then we have the infraspinatus muscle, infraspinous fossa. Again, greater tubercle, right? Subscapularis, the subscapular fossa on the anterior side, and it comes to the lesser tubercle. So these two. Okay, so the function of supraspinatus is? So when it pulls it, it goes like this.
From the reduction 0 to 15.
Right, 0 to 15 degrees. Here, the infraspinatus muscle, when it pulls it, so it would slightly extend and lateral rotate. So you would pull it backwards and slightly external rotate. Okay, the infraspinatus. And the nerves of these muscles are what? Suprascapular nerve, which the segments of the brachial plexus, right? C5 and C6, right? And another nerve that comes out from C5 and C6 with the upper trunk, right? Is nervus subclavius, right? Nervus subclavius, good. And then we have teres minor again. Teres minor comes from the upper part of the lateral border of the scapula, and again, same place, it attaches to the greater tubercle. And then we have the teres major, the lower part of the lateral border and the inferior angle. But teres major, the attachment is a little bit different. It goes under the shoulder, the armpit, and then curves around and attaches to the anterior aspect, the teres major. Okay, so it goes like this. Under the armpit and attached to the anterior border. So the function of teres major compared to teres minor is different, right?
Yeah.
Now teres minor, it pulls it backwards, just like the infraspinatus. Pulls it backward, extension and lateral rotation, right? Just like the infraspinatus. However, teres major, since it goes like under the armpit and attached to the anterior border, it would adduct and slightly medially rotate and slightly extend the arm, pull the arm backwards. So that's medial rotation. Teres major would medially rotate. However, teres minor would lateral rotate. Okay, so why? Because it covers and runs on the posterior aspect, teres minor. So all these muscles, not all, but we also have a group of muscles that is referred to as rotator cuff muscles. So which muscles are included in this?
The sits muscles.
This sits muscles. One, S,
Supraspinatus.
I,
Teres minor.
and S subscapularis. Good. So these are what? Sits muscles, and they basically cover the shoulder joint. They cover the shoulder joint, okay, and they stabilize the shoulder joint. Okay, so and sometimes this rotator cuff muscles can be torn. Okay, so that person might have like torn rotator cuff muscle, right? And if they have a torn rotator cuff muscle, so their shoulder joint becomes vulnerable for dislocation and other pathologies. Okay, why? Because these muscles basically stabilizes the shoulder joint. So teres major, why isn't teres major included in rotator cuff muscle?
It does not cover the shoulder.
It does not cover the
Right, it doesn't cover the shoulder joint. That's why. Okay, so it goes like this, and attached to the lesser tubercle at the front. Okay, and so it's nothing to do with the shoulder joint. That's that. The suprascapular nerve, when it comes to the upper border of the scapula, it passes under a ligament. What's that ligament? Right, suprascapular ligament or transverse scapular ligament. Above that ligament, you have another structure passes through there. Artery. So artery goes above the ligament, and the nerve goes below the ligament or through the foramen. Okay, so the suprascapular foramen.